In this video lecture, we'll review the diagnostic criteria for social anxiety disorder. Social anxiety disorder shares many similarities with specific phobias. In fact, you may also see this disorder referred to as social phobia. The primary diagnostic criterion for social anxiety disorder is that the individual experiences marked fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny by others. These situations might include social interactions, like having a conversation or meeting new people, situations where the person could be observed by others, like eating or drinking, or situations where the person is performing in front of others, like giving a speech. Like a specific phobia, social anxiety disorder is characterized by marked fear or anxiety. But unlike a specific phobia, which can be about any phobic object or situation, the phobic situation in social anxiety disorder is specifically about social situations. There are two different subtypes of social phobia. There's a generalized subtype, which applies when an individual has anxiety about social situations in general. These might include things like meeting new people, going to social events, going to large or small parties, or socializing in different kinds of contexts. In contrast, we can give the performance-only specifier when an individual experiences marked fear or anxiety in situations that involve speaking or performing in public. Some individuals don't experience distress or anxiety about social situations in general, but when they're engaged in public speaking, where they might be scrutinized by others, they experience marked fear or anxiety. So an individual whose social anxiety is limited to these performance contexts could be given a diagnosis of social anxiety disorder with a performance-only subtype. An individual who has anxiety about different social situations or a range of social situations would be given a diagnosis of the generalized subtype. An important component of this marked fear is that the individual is worried that he or she will act in a way that will be negatively evaluated, or they may be worried that their symptoms of anxiety will be evident in a way that is embarrassing. This is another important distinction between social phobia and a specific phobia. In a specific phobia, the type of fear is specific to the phobic object. For example, a person might be worried that a dog will bite them, or if a person has a fear of driving, they might be worried that they will crash. But the characteristic fear that characterizes social anxiety disorder is that the individual is worried that they'll be negatively evaluated in a social context. So two key things that differentiate social phobias from specific phobias are the nature of the phobic object and the nature of the fear. In social phobias, the situation that is feared is a social situation, and the nature of the fear is that the person is worried that other people will negatively evaluate them. The other criteria are very similar to what we saw for specific phobias. The fear response needs to be consistent. Social situations almost always provoke fear or anxiety. In the generalized subtype, that will apply to whatever range of social situations the person experiences fear in. For the performance-only subtype, it's going to be a consistent fear response every time they're in a performance setting. In social anxiety disorder, we also see characteristic changes in behavior. Either the person consistently avoids social situations, or if they're not able to avoid these social situations, they endure them with intense fear, anxiety, or distress. As we saw with specific phobias, in social anxiety disorder, the fear or anxiety the person experiences is disproportionate to the actual threat. The level of anxiety that a person experiences when facing a new social situation or when going into a public speaking context is excessive and disproportionate. It's also disproportionate to the person's sociocultural context. Many people experience discomfort in social situations, like going to an event where they don't know other people, or performing in front of a crowd. In social anxiety disorder, the intensity of the person's anxiety or fear is excessive in comparison to what is typical for their cultural context. To meet criteria for social anxiety disorder, the person's fear of social situations needs to be persistent. Similar to the criteria for a specific phobia, the DSM suggests that the fear or anxiety typically needs to have lasted for 6 months or more. Finally, the symptoms either cause distress, so the person is bothered by their social anxiety, or cause impairment. For example, a person may not be able to pursue new opportunities at work because of concerns around anxiety related to public speaking. Or it may interfere with the person's ability to form new relationships because they avoid different kinds of social situations. Or they may experience significant distress and be very bothered by their social phobia and want to experience less anxiety in social situations.